this next section, I want to talk about the bony prominences and pressure distribution on your foot. In terms of healing a foot wound, it's very important to know where there are any bony prominences. And all a bony prominence is when you look at a normal foot, your foot may or may not be normal. When you look at that, you have to determine, are there any prominences that could potentially rub in your shoe? This may be due to the way that you walk or any changes in your underlying foot structure. And then it's important to look at the pressure, where the pressure is in the bottom of your foot. And there are a couple of tools that we're going to go over to determine how the pressure is on the bottom of your foot. But I want to start out with a few examples with some of my patients. I had a patient initially that had pressure between the two toes. There was pressure because she had hammer toes, they were crooked, and the toes were rubbing against one another. When those toes were rubbing against one another, they developed a little ulcer between the two toes. This was caused by pressure. Pressure from shoes that were too tight, and pressure from her crooked toes that she had. The way of treating that is to use a toe spacer between the toes. This toe spacer can help space them out so that they're not rubbing and allow the wounds to heal. But they can take a long time to heal because there's maybe poor blood flow, or the person may not use the toe spacer or may go back to wearing the tight shoes that caused it in the first place. Another pressure wound that can happen is on the top of the toes, such as if you have hammer toes. The pressure on the top can rub. It may not be painful, and it will develop a little bit of a callus or an ulcer on the top of the toe. The problem with the skin on the top of the toe versus on the bottom of the foot is that between the skin and the bone on the toe, there's a lot less padding. Much easier to get or develop a bone infection. It can be very, very serious. And when you look at the foot, here's an example. Some of the most common areas where you can develop wounds are from high pressure areas. If you can imagine someone has a curved toe, if their toe is curved like this, it's going to develop more pressure on the top of the toe right here. This could develop into an ulcer. This is what's typically found with people with hammer toes. Either an ulcer on the top or an ulcer that happens on the tip of the toe. Because of the curvature, it can develop on the tip, or because when you have a hammer toe, it pushes down, you can develop a wound on the bottom of the foot as well, due to the hammer toe. Another area that you can develop a foot wound is if you have a bunion, if you have a big bump on the side of your foot, and your shoes aren't appropriate, you can develop rubbing and an ulcer on the side of the big toe. Another area that's very confusing to understand, but I'll explain it, is you could develop a callus on the big toe, but on one of the joints out here. Could develop a callus either down here or under here. Many times this is caused because when you look at the movement of the big toe joint, there's good movement on my model, but many people, when you put pressure, there's no movement there. If you don't have pressure or movement over one joint, the pressure or the movement goes to the next joint. So you would develop more pressure at this joint. It's called hallux limitus or hallux rigidus. And this increased pressure on this joint will cause this bone to move down as people are walking, as they're walking off, and it can develop a breakthrough or an ulcer on the side of the big toe. That's a very challenging ulcer to deal with because you can try different types of shoes, but it tends to recur. Other areas of pressure can be extra bones. If you have an extra bone or even a prominent bone, such as one of the two sesamoids on the bottom, or if there's another additional sesamoid or even a little bony prominence on the side of the bone, all these little bony prominences can become problematic for patients, for you. And the best way of determining it is to feel, but also get an x-ray. If you get an x-ray, you can tell if someone has, for example, a bunion or a curved hammer toe or another type of a problem. And maybe it's not just by putting a dressing on it. You have to get a special shoe an accommodative shoe that's deep enough, or even remove some of that bone that's there, especially if the bone becomes infected and gets osteomyelitis. Osteomyelitis is just a big word for a bone infection. You never want an infection to go deep enough down to the bone. Another area that we talked about before, but I want to explain a little bit more, is a condition called Charcot foot. What happens with Charcot, typically in the middle of the foot, is someone breaks the foot, like this. And their foot, when they're walking on it, they walk with it curved, like this. And this develops kind of a rocker. As someone walks, it rocks. And you can imagine this area right here in the center is where it breaks down and develops a big ulcer. That type of an ulcer is very hard to heal. And it would have a unique pressure distribution because you would have to offload that either with a special shoe or one of these called a crow walker. It's a walker, it's a walking boot that can help offload the area. These are the main types of foot deformities that we want to look at. But you also have to look at the pressure distribution. In terms of looking at the pressure distribution, we use something called a pressure stat or a Harris mat. Both of these are kind of like carbon paper. When you write your checks, it makes a carbon copy. When you step on this pressure mat, you step and it shows the area of high pressure. Here's an example of some high pressure areas, and it'll show what type of arch someone has, if they have a high arch, a normal arch, or a low arch. But it will also show where the areas of high pressure are, if there are areas of high pressure on the bottom of the foot. This is important for you to determine what areas need to be offloaded, what areas need to be treated. Another portion when looking at your high pressure areas, you have to look at your flexibility and your range of motion. Flexibility is how well your joints and tendons move. If you don't have any movement, for example, over the ankle joint, let's say your foot can't get up to 90 degrees, it's very, very straight or even pointed down because of a tight Achilles tendon. If that's the case, when you're walking, you're going to tend to put more pressure to the front of the foot as you're walking because your foot can't get past the 90-degree mark. That transfers to more pressure to the front and makes you at greater risk for developing an ulcer to the front of the foot. Many ulcers are healed only to come back again because of a tight heel cord. And sometimes it's necessary for us to lengthen the heel cord to get the wounds to heal. Another problem with the range of motion, as we talked about, is one of these other joints. If this big toe joint doesn't move, it's going to transfer pressure further out. Very important to treat, and very important to know about what's called the biomechanics of how your foot works. A lot of times there's an underlying cause of a lack of range of motion or a lack of flexibility in your foot that can lead to a foot wound. Another area when looking at the bone and pressure evaluation, a good way of looking at that is with an X-ray or an MRI. An X-ray is typically the first line of evaluation. When you look at an X-ray, you want to look for any bony prominences. And just by looking at these X-rays, you can see that there may be a high pressure area due to this hammertoe, or due to this bunion, or even due to this Charcot foot. You can see how the foot is collapsed. But one area I don't want to forget to cover is the importance of the arch of your foot. If you have a very, very high arch, the higher your arch, the more pressure you're going to put at the front of the foot or at your heel. And this can make it a greater risk of developing a wound on the bottom of the big toe. Sometimes a surgery is needed actually to kind of bolster up the big toe joint to help heal a foot ulcer. That's a very important type of a surgery along with other types of surgery. Surgery is not always the first line. We try to avoid it. But if someone is having a foot wound that's due to a bony deformity and a bony prominence, you have to remove that prominence. It's something that your surgeon will have to do for you if you get to that level. It's something important to determine. Looking at the pressure and how the pressure distribution is, and more importantly later we're going to talk about how you can offload that area, is going to be very, very important. Especially with this pressure section, you may find it a little bit repetitive. We talk about the same conditions over and over. It's because these same conditions are what cause the wound to occur and many times make it slow to heal. One last part I want to cover in terms of x-rays is the importance for determining how deep the wound goes and see if the wound goes down to the bone. That's called a bone infection or osteomyelitis. If you do an x-ray and you can compare one x-ray to another, for example, a couple of weeks apart, you may be able to determine by looking at the same bone if there's any changes we call osteomyelitis or changes in the bone quality. If there are little areas of the bone missing, change in the color, change in the texture, that can be a sign of a bone infection. If you have a bone infection, it's much more important to be treated with IV antibiotics or have that bone removed. Bone infection normally doesn't just go away by itself. It needs to be treated. And it's one of the most common reasons why wounds come back over and over, either due to a high bony prominence area, a pressure area, something in there, or due to a bone that's infected, that the skin heals over the top, the bone has an infection, and then it opens up again. So in this section, we've covered the different types of foot deformities, the different types of high pressure areas, how to offload them a little bit, and then the importance of x-rays in terms of healing your foot wound. These foot deformities, and as well taking the pressure off, are really the two most important sections that I found in terms of healing foot wounds. What you put on the wound and everything else isn't going to help. You can put all the dressings and all the special medications on a wound you would like, but if you don't know what's causing it, what's the underlying cause, it's going to be very slow to heal.